Hi, my name is Dr. Drury, and in my practice over the years, we've helped hundreds of people get well from their migraine pain. What I found is most of my patients, when they first came in, were taking medications which would temporarily mask the symptoms but never really correct the underlying cause. So eventually the migraines would keep coming back and never really go away and be well. First, you have to understand the mechanism of a migraine to understand what causes them. And what happens is you have these blood vessels that supply blood to the brain. Well, when those blood vessels, they open and they close, they get thicker, they constrict and they dilate depending on how much blood is needed to get to the brain. Well, when those blood vessels are constricted and the brain needs more blood, the messages from the brain go down to the brainstem, to the upper part of the neck, and then travel up nerves back up into the head, which then allow the blood vessels to open up and increase blood flow to the brain. Well, if those messages from the brain to those blood vessels get interfered with, then it reduces the amount of blood flow to the brain. Okay, and so what I do as an upper cervical doctor is we look right up here at the upper part of the neck, at that brainstem area, and we look to see if there may be something interfering with the normal messages from your brain to those blood vessels that supply that blood. If there is, and we can find it, and we can remove that interference, now all of a sudden the messages, the normal messages from your brain to those blood vessels get there normally, properly. Then the blood vessels can dilate or open up to supply proper blood flow to the brain. Then we see the migraine pain starting to dissipate, and then they go away by correcting the cause, not by just masking it. They go away and they stay away.